If you have good mentorship in your first year, you can accomplish this. Hi, everyone. Welcome back to the podcast. Welcome all you new listeners and anybody else who's been around with me in the past. Welcome back. Today, I got you. You love that title. What PTs can learn from Michael Jackson himself. What is this podcast about, and how are we gonna link PTs to Michael Jackson? Let me tell you. Before I tell you about the podcast, I want to give you some updates, life updates. Last week, I explained to you guys that my son negotiated with me, and he's out of Taekwondo. He is officially now into soccer. They start school next week, so I'm really, really excited to get them back in a routine. We all can use that time to just get back into some form of normalcy. And right now, I've been with the kids at home, and that's been great. But I'm excited to get back to my routine as well, and so is my wife. My son Jacob is doing fantastic. He just is now over a month, and he is getting more head control, which is exciting for me as a dad. Um, On to the podcast. Why are we talking about this? I've had two big discussions with team members recently about haircuts, about experiences at a restaurant, and how does this tie in? All right. So first, one of the discussions was we were talking about how well they're doing in their performance. And we regularly have performance reviews. We talk about it in passing, how things going, what do you need, what do you need to get better at, where do you need my help? And somebody complimented. They said, you make it look so easy when you're treating. And I said, thank you, first and foremost. And I said, what about it? And they said, it feels like you're really just hanging out with clients. You're putting on a show. And I said, thank you, but that's years and years of like fine tuning, and all of you can think of that person who you look up to, and you're like, man, I love what they do, or they do it so well, and that could be somebody who is a great clinician, or somebody who just does mobilization so great, and the client just feels so amazing, or the patient feels so amazing, or it can be outside of that. It can be a teacher, it can be somebody who plays golf. You could just see like it's fluid, it's beautiful, and they do it so well, but yet that took so much time to get to that point. And then I had a conversation with Diego. If you guys haven't met Diego, he's our marketing assistant here on the team, and we were talking about clinicians. And when you get feedback from people outside of PT, you take it and you learn from it. And I asked Diego about what he experiences, what he sees as a marketer, and what PTs do. And his view is very, very different. He talks about he doesn't know the nuances or the actual terms or the vocabulary. He could just see like what is happening during a session. And he says, everybody has a different rhythm, a different flow. And I agree with him. So I explained the progressions of physical therapists along the years. And for some, these progressions are in 3 to 4 year blocks. Up front, I think there's three main progressions. First 4 years, second 4 years, third 4 years before you really get to, like a true master, if you wanted to quote unquote. And you really actually have seen the majority of cases. Now you're just fine tuning things. But I think you can expedite a lot of that. Nonetheless, how does this relate to Mr. Michael Jackson himself? All right. And I explained this to Diego and telling him that physical therapists, there's three kind of easy phases in their first year. And it takes longer for some of the new grads to experience this if they have no mentorship. Here at Sports Performance, there's kind of three main blocks that they'll go through in the first year, 9 months to a year, and we've seen it over and over and over again, and it's great because you can see people progressing as expected, and it's amazing to see them blossom. So, what are these three phases, and how does it correlate? Michael Jackson, at one point, was a singer, right? Like he could dance, right? He can sing. He had some vocal cords, and knowing that he had beautiful vocal cords, or he had talent, right? You can just hear that, right? So as on the radio, you can hear he has talent, right? But at first, he had to learn lyrics, right? Before he can sing, you got to know lyrics that are going to go to a song. So you study the lyrics and you recite those over and over again. You keep going, you keep going, keep going. Every singer, every artist has to start at this point, right? Like this is where they go. If they can dance but not sing, they're just a dancer. I shouldn't say just. They are a dancer, right? So Michael Jackson had some vocal cords. So he had to learn the lyrics to the song, okay? But he's also blessed with good dancing ability. Like he could move, and it was pretty amazing to watch. So there's a difference between being a singer and a artist, right? Like somebody who can put on a show. So Michael Jackson could sing, he can learn those lyrics, and then he could dance. But one had to happen first, and then for them to happen simultaneously is a different story. So learn the lyrics, then sing. Once you know those things, you don't have to focus on those anymore. You can now go on autopilot and then dance. Because if you don't know the lyrics to a song and you can't dance, that's very complicated. So he knew the lyrics, he could sing, and then he can just dance. And once you put those together, that's called a show. And so he had to start with the lyrics, learn the song, put those together with dance moves, learn the routine. And once you put that together, that became truly an experience, a show that he could just entertain people. And that's why people came back. Not just because of the dance moves, not because of the lyrics and the beat, because when put together, it created something larger, it created an experience. So now you have the audio, now you have the video, and then you put those together and create a concert or something where it is an incredible experience that people want to come back to. So I think we can all agree that he was great at those things. He could just entertain you. And so how does this go into your practice as a physical therapist? I was explaining to him that when you have a new grad physical therapist or even a student, and don't get offended, this is it could have you could have been a rock star new grad, you're different from everybody. I'm just generalizing, okay? So when you have a new grad physical therapist, they're coming out of school, and maybe you're listening to this, you're a third year, second year, or you're a new grad, or you're established, and maybe you're still going through this. But every new grad goes through this. They're going to go in, and we're all fixated, and I'm saying we because I've been through this. You're fixated on getting the measurements and looking at the knee so you can have the numbers to support your documentation to have people come back. So when you do that and you're so focused on the knee range of motion or the knee swelling, and you're using that to justify that they're getting better and using that to submit to insurance for reimbursement, you forget that that knee is attached to a human who has a brain and has emotions, and what you do with that knee is very different from how they feel at the end of that session. And what I mean by that is you're so focused on the tactical hard skills, and it's not your fault, it's the PT school's fault. You're so focused on the hard skills and assuming that that is the thing that's going to get them 100% pain free. So at first, in new grad, you're just hard skills based. You're trying to learn the best techniques to get them pain free. That's like learning the lyrics to a song. You're just learning the foundation. You're just reading the things on the lines, but you don't know how to sing yet. You're just learning the lyrics. Okay, and that takes it. And I've seen this. If you got mentorship right on top of you, it probably takes 3 months to really get you to understand. The hard skills are really important, but you don't let go of those because those are going to put you into a really good place professionally. But if people are not coming back to your sessions, then that's a different conversation. It's not that you don't have the hard skills. Now let's talk about the second piece, which Michael Jackson could read those lyrics, and then now he could sing. He can put those in a context and, have the intonation and really understand to create emotion out of an audio experience. And that's the second phase for physical therapists, is the soft skills. The first 3 months, you're just trying to hone in on the hard skills. Let me just prove it to you. And you're like, and then you start experiencing like, wait a minute, nobody's on my schedule anymore. What happened? People don't show up, they're discharged, or they self-discharge, because what you failed to do is establish a relationship with them to help them understand that you actually really care about them. Yes, you care about their need, but they don't feel that. And so what happens at that point is that person loses that connection. And if this doesn't make sense to you, you have to consider this. I asked Diego, I said, hey, do you enjoy getting your hair cut? And he says, I do. I said, why? Because that person's into me. They're talking about all this stuff. Okay, great. So what if they just gave you a haircut and didn't talk at all? It'd probably be pretty boring. Would you go back? No. Even if it was cheap? It's not that big of a factor, but really what you're looking for is somebody who just cares about you. That's what they want to know. If they can feel that they care about you, care about them, 100% they're going to come back. But you also have to have the hard skills to have an outcome. So you have to have the lyrics, and you have to have the soft skills, the relationship building, so that they feel that empathy, that they feel that you're actually engaged in not just their knee, but their life and what they want to accomplish out of that knee injury. So that's the soft skills. And then you start fine-tuning those. That is easily 3 months to 6 months. So you have 3 months of building hard skills with good mentorship. You have another 3 to 6 months of building the soft skills, those relationship skills, so that they feel what you're trying to do for them. Now, if you've got great hard skills, now you're actually getting them better. And then you're developing your soft skills and they actually feel that. Guess what that last phase is? Is putting on a show. Just like Michael Jackson. He had those lyrics, he could sing, he could dance. Now put those together where you don't have to memorize. You've already memorized the lyrics. You don't have to look at a piece of paper anymore. You already know the routine. Now it just looks so fluid. You're putting on show. You've got all this stuff going around, and it makes it look so fluid. If you have good mentorship in your first year, you can accomplish this. And I've seen it. So, yes, you work on your hard skills. That'll take you 3 months to really understand that if you just focus on that, it's only going to take you so far. Then you actually have to look at relationship building and creating that empathy with clients or patients. That'll take you a good 3 to 6 months. And then putting it all together and making patients and clients feel like, I don't even know what they just did, but I feel amazing. You worked on the knee, but you're talking about their weekend. You've got another patient or client who's in the room too, and they're doing their exercises, and you really like running a room. You're just enjoying the culture, and it's fun. That's when you love your job, is when they can feel that you're just literally helping all these people, and you're also putting on a show so they have a good experience, and they want to come back. And that is a physical therapist who has that passion. If you didn't listen to my last week's podcast, listen to that. Who has that passion and doesn't rely purely on their hard skills, doesn't rely just on their soft skills, but who can put that all together consistently and put on a show. Now, not every client's going to want this, because some clients are, or some patients or clients are, different demeanor. They're coming in at different time points, but somebody who's fresh and new and they're not feeling good, they're anxious about their injury, that's a little tough. But as you get people to a certain point, they're 3 to 4 visits in, you've got 50 to 90% improvement. These people are excited. They're passionate about going to PT, and that's why you got into it. Just remember that, right? That passion. So when these people have that great experience, they're going to be patients and clients for life, Because the minute they ask and they say, hey, or somebody says, hey, where do you go to physical therapy? And they're like, I go to Joe Schmo PT down the road. And, they are incredible. They got me back to running. And notice that I didn't say they got my knee better. So a lot of times what they're going to be focused on is the outcome, not the hard skill, technical challenge that you just overcame. They want to get back to something. And so you got to focus on that. So when you're looking at developing your hard skills, and this is for this podcast episode is for everyone, like at all stages. I mentioned this on my last podcast. You've got aspiring PTs, you've got uh, PT students, you've got new grads, you've got established PTs, and you have veterans. Everywhere across the board. If you're a new grad, this is definitely very relevant to you. Quickly get out of just looking at the knee swelling, and I'm just looking at how much is that pitting edema, non-pitting edema, what's the measurement, you're getting better, don't worry about it. That's only going to take you so far. Start looking at developing that relationship and helping them truly understand what you're about to do with them. Show the empathy, eye contact, body language, work on all those fundamentals. And if you're not working on that, you're missing out on a good 40-50% of the whole session. Depends on the setting and scenario you're in, but ultimately, I don't care if I'm in the hospital, or I'm working pediatrics. I love pediatrics, by the way. These are the king and queens of relationships. When you work with peds, it's all about that relationship. They have to feel that you're genuinely involved in that. And it's funny, the minute that we go towards adults, you're assuming that because they're older, that they don't want that same relationship. I've said this before. All adults are kids with arthritis. We're all the same. We have the same mentality. We keep it as an adult from the kids. And we still want that same thing. We want the bond. We want the relationship. So when I go to a restaurant or I get a haircut, I'm looking to see how they try and create a relationship with me, because I know that they can cook. I get it. Like, if you look at this, you have meat, a steak, right? And you can buy that anywhere, right? So how do you go from a $3 a pound steak to, like, I don't know, what are fancy restaurants nowadays to pay for a steak? $50. How did it go from $3 to $50 at a restaurant? What's the difference? Well, this steak had to be shipped somewhere, cooked, marinated by somebody who is really good at it, a chef, right? They added something else. But it's still not worth anything unless they create an experience out of it. So once they create an experience of it, now I'm willing to pay the $50. Does that make sense? So when people come in, they're looking not just to get their knee fixed. They're trying to really, if I'm going to spend an hour somewhere, I'd like to have a good time, right? Not just feel good, like better about my knee, but also have a good time. And from there, they're going to want to come back. And wherever you're working, that makes you feel good about what you're doing, because it makes you feel like you're actually productive. You're actually contributing to this planet. You're actually getting people better and above and beyond. You're not just doing the lyrics. You're not just doing the hard skills. I think we're all going to get really, really bored of that. And that's the same as the meat to chef to restaurant experience. And so if you just focus on hard skills, which I feel like a lot of physical therapists do, you can get hard skills anywhere, any PT clinic. But then also start learning how to create better relationships and create a great experience so that they actually want to come back and they refer all their people to you. That is a fantastic physical therapist, and I've seen a lot of them. I've had a lot of great mentors with that. If they listen to this podcast, John DeWitt out of The Ohio State University, the guy could sell ice in Alaska because he would just put on a show, and he's a great mentor. And he was the first time I actually saw somebody. It didn't even feel like physical therapy. It felt like, if you've ever been in an athletic training room, it just felt like a culture where everyone's joking, laughing, but at the same time they're being productive. Hey, do your work. Perfect. Telling jokes, having a good time. And it felt like a bar, like you're going out to a club and all these people are doing exercises in that club, and there was good music, everyone's having a great time, and by the time they leave, it's like an hour and a half. They're like, oh my gosh, I gotta go somewhere, I didn't realize it. And when you have somebody like that, you're like, I did a great job. Like, that person lost track of time because they loved being here. And that's the experience that I always strive for. I'm always trying to make sure that people feel valued, and they love being it in our clinic, in our facility, in our presence, and I advocate that for everybody. And it doesn't you can extrapolate this beyond a physical therapy clinic. Literally, your hair salon or your barber. If you go to a hair salon, right, and somebody just cuts your hair, full silence, wash your hair, it's like boring. You're like, can I go now? Versus, and I think that's why a lot of barbershops started introducing alcohol into their establishments, is because it helped the person ease up. They would have talked more. It allowed them to have a full experience, and it changed the mindset of it's not a haircut, it's an experience. And so just know that, just like Michael Jackson, who put on a show, who had great lyrics or could sing the lyrics and could dance, but he could put on a show. And I challenge you to do that. Uh, don't go and change like dramatically, what you're about to do. But I'm telling you right now, great physical therapists, especially in the pro settings, it is it is about the relationship that you have. The hard skills are assumed. It When you go to the pros, you've already learned the lyrics, and you better be able to dance. Like, you better be able to manage high level injuries. Know the basics of strength and conditioning. Know the lyrics of basic manual treatment, taping techniques, all those things. And assuming you've got all the lyrics and the hard skills, you can tape, you can do soft tissue work, you can manipulate whatever your lingo is. That's assumed you can do all that. Next, you have to have a relationship. If you're in the NBA, you have a relationship with all your players. The hard skills is assumed. What they're looking for is, can this person hang with us? Can they establish a relationship and make me feel like I'm going to be okay all season? And that's always, they're watching you like a hawk. If you ever want to work in the pros, you better be ready, because they're on you all the time. You better not be sitting, back and slouching. They expect you to be on all the time. Your professional demeanor, your motivate all the time. It's exhausting, but fun. And what they're looking for is Michael Jackson's. They want to be able to see somebody put on a show. Not only make their athletes, keep them healthy, but make them feel like they're valued. And then honestly, that they're entertained, that they actually feel safe in this environment, because you're with them all day, every day. And if you are boring and can't develop that relationship, you will not last. I tell people all the time. And I think that a lot of times we're not allowed to think like this. We're not allowed to, in a typical orthopedic clinic, you're supposed to be professional. Yep, yes, ma'am, absolutely. Yes. What's your range of motion? Yep. What else? How old are you? What are your heart? What are your comorbidities? Absolutely. Okay, got it. Here's a range of motion. Here's a GONI. Here's a measurement. You're actually improving. Have a great day. We'll see you 3 times a week for the next 87 weeks. That's not what people want to come for. People want to feel good. I don't care about your setting. If it's neuro and you had somebody with a stroke, they're down in the dumps. They want to feel good. You got support their family, make them smile, have a good time outside of the, walking and, doing range of motion and strength and everything. They give them positivity. And that's what I mean by putting on a show and dancing. Don't be dull. Make it happen, because people want that. And so just remember, wherever you are along the continuum, you might be learning the lyrics, or maybe you're in PT school and you're learning the lyrics. If you're in PT school and you're listening to this, you are ahead of the game, because it's the mindset shift from understanding that in PT school, they're going to give you the hard skills. That is their job. Can they have you pass a national exam with 100% hard skills. And then it's your clinical rotations and then your previous past experiences that give you more insight into the soft skills and relationship building. If you don't have those soft skills, you better find somebody to help you out, or you better start observing people more regularly because it is critical. If not, it's going to be hard for you to be out in a clinic. It might be better for you to be on the research side, where it's not so much the soft skills as much because you're not seeing 20 people a day or whatever that is. Now, if you've got hard skills in PT school, you learn that, you had a really good mentor, you have really good soft skills, good for you. Now, blend those together so that people come to see you. Every clinic wants that. And I think if you think about a clinic wherever you work right now, you probably have that 1, 2, 3, 4 people in your clinic, or maybe it's you. Now I'm just kind of supporting what you knew, but it's nice to know that you're on the right path. That every clinic wants happy, jovial people in their clinic. I don't know what clinic doesn't want that. If you do, you might want to consider a different clinic. But if your clinic has that, that's beautiful. Now you have to ask why. Like, why when this person comes in the room or these 3 people are in the room, why does it feel so fun in here? Now contribute to that. But you almost have to have all the hard skills, all the lyrics, so that way you cannot think about those things, and then work on your relationship skills, and then really just put on a show. That's the art. This is truly the art of being a physical therapist. Because if it was truly just about knees and ankles, they wouldn't have a connection to the brain, and the brain is what changes everything. And the minute that you have input or output going to that knee joint, it has to feed into the central processing, and that central processing is affected by many things. And that is the central processing is that brain, which is going to now read the relationship that that person has, the trust. The minute that you come in to grab their knee, are you coming in with like little pokey fingers, or are you coming in with a lot of surface contact, embracing it, more surface area, and looking them in the eye and telling them, reassuring them and being honest and genuine about what this knee feels like, here's what's happening, the intonation, all those things make a difference in how people trust you. Think about a surgeon. They literally go in for 2 to 3 minutes, do a test, and they're out. Now, for a surgeon, you want 100% hard skills. You better have a person who has the best hard skills possible as a surgeon. Now, their soft skills aren't going to be so important because their service is based on a one-time transaction, right? Can they do the job? In PT is a little different because now you're talking about pain. Pain is, we all know this, it's very, there's a lot of psychosocial factors. And because of those psychosocial factors, pain is all relative. And so you got to figure out, the person's real root of it. Is it truly just coming down from, the knee joint? Is there perception of pain? Is it the cultural beliefs in pain? I mean, there's so many layers. And so by the time they get to surgery, it's easy. It's a tactical, like hard skill based relationship. In our world, it's very much soft skill based. And when you have to combine those two, then you get trust, you get value, you get commitment, you get confidence, you get returning clients and patients. And that's how it works. So, all in all, you're just like Michael Jackson. That's literally the truth. You're putting on a show. Yes, I did say Michael Jackson, or it could have been. I was giving the example of who could do all three. Who could do the lyrics, who can do the dancing, and who can put it on a show. I mean, you've got pretty good artists in the past. I was trying to think of who else can do it currently. You had don't judge me. I think Justin Bieber at his time, he was novel, he was new, he could do all three. So it was very rare for people to be able to do those things. Chris Brown, just really good artists that you were like, they're definitely not just a singer, or they're not just a dancer, and you want to go to those concerts. Think about the people you're like, that concert was amazing. Lady Gaga, whatever it is. Think about that. And if you've ever been to a horrible concert, what about their concert was horrible? To put it in this context, what concert did you go to that you've listened to this person on the radio and you're like, oh my goodness, look at those vocal cords, like they can just sing. And then you go to their show and they're like, ooh, that was boring. It's because they couldn't put it together. They had the hard skills, no soft skills, and could not put on that show. So don't do that. I want you to focus in on doing all three of those together. And this is nothing new to my team. This is what we literally do at Sports Performance. We focus on just making people feel good and valued, and work on the hard skills. We do that every single week. Tuesdays is our technical Tuesdays. We work on it all the time, but also really talking about the behind the scenes and what else it takes to be able to dance and do that. Because if you can't do that, people aren't going to come back to see you. So I hope that helps. And the next time you hear Michael Jackson, think about your personal practice. Okay. All right, guys. I hope you enjoyed the latest episode, and I will catch up to you guys on the next one. See you guys.